Hello, Namaskar. I'm Dr. Preeti Chhabria, Director of Internal Medicine and Geriatrics at Sir H.N. Reliance Foundation Hospital. Welcome to Facebook Live, where we would like to discuss about how vaccines can help to protect us. This is the World Immunization Week, and hence it's wholly befitting that we should understand a little about immunization and how that can play an important role in protecting us from various illnesses. So I get asked a lot by patients, tell me methods of boosting our immunity with medications, with vitamins. And hence I'd like to emphasize that one very important method of boosting our immunity is with vaccines. As children, we use a number of vaccines to protect from illnesses. And so I get asked a lot that why is it that elders or adults need vaccinations? Is that only not meant for children? But in real life, it's very important as the aging occurs, as the immunity wanes, booster doses of vaccines should be given. And there are specific vaccines, particularly in the adults, which play a very important role. Now, immunization per se is the use of vaccines to enhance our immunity against bacterial as well as viral pathogens. In the COVID pandemic, we really understood the importance of vaccination. For all the naysayers, it's very clear that we were able to convert the pandemic to an endemic with the abundant and the widespread use of vaccines for COVID-19. Smallpox as well as poliovirus were almost removed from the face of this earth with the use of vaccines, which also contributed to build the herd immunity. Recently, we had an upsurge of monkeypox virus. Again, with the use of vaccines, that too has been abated. Now, there are two types of vaccinations available. One is called the passive vaccines. Passive vaccines is actually providing preformed antibodies to a particular bacteria or virus. This is usually used only after a certain exposure to an infection has occurred. For instance, in the rabies exposure, or we used it also in the COVID-19 exposures. However, the disadvantage of this passive vaccination is that the immunity is very short-lived as long as the antibody remains in the system. So the more robust method of vaccination or immunization is the active vaccinations. Now, active vaccination actually involves injecting a small part or subpart of the virus or bacteria into the body. This is recognized by our immune cells, which produce a small amount of antibodies. And this goes into the memory of our immune cells, so that in real life, when we are actually exposed to the full-blown virus or bacteria, those memory cells come charged on. They produce the antibodies. They come in full force to protect us from a full-blown infection. And that's what vaccines provide us. They don't guarantee that we will never get the infection. They guarantee that if at all we do get the infection, it's a very mild infection because your immune responses have recognized the particular bug and are protecting your body against it. Now, again, among the active vaccines, we have live vaccines, which have the live bacteria or virus, but in a much milder form. Now, these are very few, and only among the examples of these are like the measles, mumps, the rubella, and the varicella vaccine. Even we have an oral polio vaccine. The majority of the vaccines, however, are the inactivated vaccines. So the bacterial virus is given in an inactivated form. And the more recent or the more advanced form of the vaccines are the recombinant vaccine, where the actual part or subpart of the bacterial virus, the protein part of it is synthesized in a lab. So these are turning out to be extremely safe to be injected into the body. Having understood what vaccines do and how they play out their role, let's look at the different subgroups of adults and how we should consider vaccinations, particular types for them. So let's look at first women in the childbearing group. First and foremost, all women in the childbearing group should not take any live vaccine if they are planning to conceive within the next 4 weeks. So even if they are planning a conception, they should ideally not take any live vaccines. In fact, women in the childbearing age group, when they are planning a conception, they should see their doctor and get tested for to check whether they have immunity for measles, mumps, rubella, and varicella. And if they don't have that, they should take those vaccines much before they contemplate their pregnancy. Now, women who are pregnant, they also need a series of vaccinations. First, of course, if in the flu season, they need the flu vaccine because the morbidity or the trouble that flu causes in a pregnant woman can be quite extensive. The second vaccine that pregnant women should take is called the Tdap or the Bostrix vaccine, which is actually a combination of tetanus, diphtheria, and pertussis. This is taken after the 26th week and is taken in every pregnancy, no matter how far spaced out the pregnancies are. But in every pregnancy, these are recommended. Now, the advantage of vaccinating pregnant women is that the antibodies which the pregnant mother mounts is transferred via the placenta to the child, so that in the first few months they remain protected from pertussis, from flu. So that's an important thing to remember among our pregnant women. The second group of adults which need particular attention for vaccines is our elders. Persons over the age of 65 years need frequent boosters because the immune system is also aging, which is called as immunosenescence. In fact, in several countries around the world, the flu vaccine for elders is given at a much higher dose than that for the average adult. So among the elder population, the first important vaccine is again the Tdap, that's the tetanus, diphtheria, and pertussis, which is given as a booster. It's particularly important among all grandparents who are going to be dealing with infants or handling infants below the age of 1 year. They should get their Tdap booster dose. The second vaccine for the elders is the influenza or the flu vaccine, which should be taken every year because about 90% of deaths worldwide due to influenza occur among the elder population. The third important vaccine among elders is the pneumococcal vaccine. There are several types of pneumococcal vaccine available, so your doctor or physician will be able to guide you effectively into which pneumococcal vaccine and how that is to be dosed. One very important vaccine among persons over the age of 50 years is the herpes zoster vaccine, which not only reduces the frequency of herpes zoster or shingles, but it also reduces the incidence of the devastating pain that occurs after herpes zoster if it were to occur, which is called as the post-herpetic neuralgias. Now, this can also be given to adults over the age of 19 years if at all they have any immunocompromising condition. Now, this herpes zoster is given, vaccine is given over 2 doses. Certain other candidates are like persons who have had a spleen removed or who are planning to have the spleen removed for various other medical conditions. Those who are recipients of certain transplants, others who have immunocompromising conditions, they too need specific doses of vaccines that are administered. Pre-travel to certain areas of the world will need vaccinations against specific illnesses. In fact, bone marrow transplant recipients almost need revaccination. It's as if they are going through their childhood as far as the bone marrow is concerned, and so they need a series of vaccinations to be done. In particular, besides the vaccines we've talked about, there is the hepatitis A vaccine, hepatitis B vaccine, meningococcal vaccine, which is particularly important for people who go to certain pilgrimages in certain parts of the world, such as the Hajj. That's recommended. It's also recommended among students who live in close quarters in hostels. The meningococcal vaccine is recommended. There is also the rabies vaccine, which should be given promptly after any dog bite, or it is also recommended among people who make various trips into the deep forests or who work in labs where their exposure to rabies virus can be encountered. Now, having understood the different types of vaccines, how is a vaccine given? It's given very simply via intramuscular or an injection underneath the skin. Now, lots of people ask me, I have a history of allergies, I want blood thinners, should I be taking the vaccine? So let's answer those particular queries, or let's clear those doubts. Certainly, anyone on a blood thinner can take the vaccine. Just inform your doctor ahead of time. We take certain precautions, such as giving the injection with a very thin needle and making sure that you are not prone to any bleeding during that period, which is extremely rare. People with common allergies, who have a minor cough and cold, can also proceed with getting any vaccine that is advised by your doctor. The only indications for really not taking a vaccine is if you've had a serious, life-threatening allergic reaction to any vaccine in the past. And the second thing is if you have a serious neurological disease after taking a vaccine in the past. These are the 2 major reasons which you should inform your doctor about at which point, taking a vaccine will be taken into consideration. Now, having gone over all the various aspects of immunization and vaccine, I would like to sum up and say that these are essentially our health, our advantage. As a take-home message, once again, I get asked by patients, Doctor, do you take vaccines? If you recommend it to us, are you one of the persons who would also take it? And without any doubt, I would like to emphasize, yes, I am a strong proponent of vaccination because not only when I vaccinate myself, not only do I protect myself from my illness, but I also protect my patients. Because if I am healthy, I am likely not to transmit the same illness to my patients who depend on me. So as a take-home message, let's all believe and advocate vaccination to all our friends and family. Thank you.